Today we're going to go over the procedure for lipo-cavitation. We're going to start with preparation. Make sure there is enough ultrasound gel for the treatment. Put on a new pair of gloves and place dental bibs on the client. Now we're going to cleanse. Wipe down the treatment area with a soft cloth. Ensure that any lotion or product is wiped off the skin. Now we're going to use vacuum and radio frequency, which is our suction setting. On the machine, click vacuum and bipolar RF. Set the suction on the lowest setting, which is number 1. Adjust the treatment time for 2 to 5 minutes, depending on the client's comfort level. Move the handpiece quickly and remain straight and flush with the skin by using a cupping method. Do not go diagonal or else the handpiece will pick up the skin wrong and it will be harder to pull. Go around the entire area you are treating. No specific pattern is necessary for this setting. Only move the device in a dragging motion if the client is able to tolerate it. Suction helps to remove bloating, water weight, and prepare the area for fat reduction. Now we're going to cover our 40K ultrasound lipo-cavitation setting. On the machine, click 40K and set it on mode D. Adjust the bar settings to halfway or higher depending on the client's comfort level. After a few treatments, you can start upping the bars. If the client can tolerate the sound, then you may increase the settings. Adjust the treatment time anywhere between 15 to 20 minutes. Apply ultrasound gel to the entire treatment area. Reapply when the device starts to feel like it's sticking to the skin. Put on a new clean pair of gloves. Apply pressure and move the device in a slow, kneading-like motion. Use clockwise circular motions to massage, mold, and contour the area as you go. The slower the better. To work on lymphatic drainage, push upwards towards the center, gravitating towards the heart. This handpiece does not heat up, so it's safe to move slowly in order to really contour the area being treated. Remember that with body treatments, the technicians become the artists. We have the ability to create shape. With the ultrasound lipo-cavitation, this sends ultrasound waves into the fat storage, which creates pressure, causing the fat cells to implode. The body then gets rid of the fat cells through the lymphatic system. Now we're going to go over tripolar RF. On the machine, click tripolar RF. You may bump the settings up all the way and set the treatment time for 10 minutes. Move in slow circular clockwise motions. This handpiece does get warm. Not as hot as the Legacy, but it does get warm, so it must continuously move across the skin. Never park the handpiece on the skin for any amount of time. Always lift the handpiece up and off the skin if you need to pause for a moment. Apply a pressure massage onto the treatment area to help contour. Radio frequency is helping with tightening the skin after the previous fat reduction setting. On the machine, click Bio and set it on mode D. Bump the bars up halfway and set the treatment time for 5 minutes. Move the handpiece in circular motions upwards and then glide it straight down. For slimmer clients, microcurrent will help tone and refine the muscles. The last step we're going to do is cleanse. Remove all the remaining ultrasound gel from the client with a soft cloth. Hand the client a dry, soft cloth so they can wipe off any leftover ultrasound gel. Toss the used dental bib away. Now let's talk about cleanup. After every treatment, use Cavicide wipes to clean each handpiece. Clean inside each handpiece, making sure there is no ultrasound gel remaining. For any hard-to-get areas, you may use a toothbrush or Cavicide spray. Make sure to wipe down the entire handpiece. For the treatment bed, when wiping down the treatment bed, make sure there is no ultrasound gel left behind. Be sure to clean the counters and all products used. Leave the room as it was left for you.